Dr. Todd Snyder here. This is our 8th and last episode on smile design, where we'll be discussing occlusion. Now, occlusion is typically the most important aspect of dentistry and is the first thing that we evaluate in the TS system. Now, it's extremely important to have proper function, but when it comes to smile design for appearance, it's one of the last things we're incorporating into our discussion here because we recognize it's really the first thing we always evaluate, and you can't do smile design if you don't have good occlusion. So all of the focus typically on the cosmetic appearance and aesthetic appeal of the upper teeth, we typically don't think of occlusion as having a big role in our smile design. However, based on how one's teeth come together, we may be having to alter the occlusion either by starting treatment with orthodontic procedures or other forms of occlusion analysis before we can do restorative work. So understand that it's the most important thing, but in looking at smile design, we kind of assume that's already been taken care of. So now also the lack of occlusion can have an impact on someone's appearance as well. And so sometimes building occlusion in becomes important. Now, most patients don't show much of their lower teeth when they smile due to the overlap of the upper and lower teeth, right? So typically we're not seeing them. So oftentimes the occlusal kind of function is absent from our view, but it doesn't mean it's not important. However, some of our patients do show their lower teeth when they smile, but most patients will show them only a little bit, maybe when talking. So when we look at how the lower teeth play a role in the final tooth position of the upper teeth, as well as if they're symmetric in relationship to the facial midline, we start looking at crowding and spacing and how teeth are coupling or coming together, or maybe not coming together at all. Now, you'll notice in this case that everything comes together nicely. It looks like the person's gone through braces and the teeth come together well. What we don't see is how the patient started. So we had a lack of occlusion in the anterior dentition. They had already been through braces and they were not happy with the darkness that was coming through from the oral pharynx where the teeth were not overlapping. And so all of these became an issue as far as the patient looking at herself and smiling. So this distraction was a concern. So the patient doesn't have occlusion on the anterior 6 teeth, even though they've just finished braces. Now, many of these teeth we need to build up and or lengthen to create occlusion. And oftentimes in creating occlusion, we're creating a better function for that patient. So if after doing our ideal smile design, we can alter the teeth and create a better occlusion at the same time, then that's obviously a win. So we knew what the occlusion was before doing our smile design, and now we're seeing if we can better the occlusion with our restorative treatment, or if we need additional orthodontic work before being able to work on the patient to achieve the desired outcome. Now, here you can see the before and after of how we created a beautiful new smile and at the same time address her occlusion, all at the same time using just restorative dentistry. Now, in restoring or altering a smile and one's appearance, it should always be noted that in changing one's appearance, we can't create perfection. We can only try to improve upon what we encounter. And sometimes patients will tie your hands. You'll have to decide if you want to move forward with them or not. So there's always going to be some level of limitation. We want to make sure the patient understands what that is and that we point it out so we can refer back to it later on. So it's always best to identify those early and explain them to the patient. So in doing so, when we see patients like this, we can see asymmetries now not only in the lip position, but we can also see asymmetries in the gum tissues as far as how much is displayed. We can also see asymmetries in the actual gingival position as far as the zenith and height and contour. And so in looking at those, we start to also evaluate embrasure spaces, buccal corridor, tooth angulation and or rotation. And we start looking at width, percentages, golden proportions. And so we start to look at smiles very quickly and easily with all of this knowledge we've shared. And so hopefully you now have some basic knowledge that in looking at smiles and taking photographs and using models, you can start to better understand where someone's at currently and through your evaluation process lead them to a better place. Now, hopefully this information has become quite helpful for you as far as a kind of a simple overview. And this obviously brings us to the end of these episodes. And although very brief, we've touched on some of the most important aspects of smile design concepts within the TS system. So the next time you have that kind of patient that has a lot of things going on, you hopefully have more understanding to see the face, in a different light and start to implement some of these tricks like the split image reflection technique, along with many of the traditional photographs and metrics to help you with your analysis and smile design. So I hope this series has been helpful and enlightening. And if you want to learn more about cosmetic dentistry, go to legion.dentist, where I've got numerous courses to help you, such as Ultimate Veneers. All the best to you in your career.